Okay, here's the long-awaited EKG video. I'm going to go through the setup, everything that you need, how to set the monitor up, and then we're going to actually look at a patient that is having a 12 lead done so you can see what that would look like and how to send it to Muse. First let's talk about the leads that you're using now. So right now when we put the leads on the patient and we are not worried about a 12 lead, it can be a little bit forgiving because you're just looking at a rhythm. But for us to be ready to do a 12 lead EKG, we have to place the first 5 leads in the proper place so that we don't have to move them when we go to do the 12 lead. And so the first 3 leads that we're going to use obviously is the white and the black. Okay, so it's RA and LA, right arm, left arm, and then the first V lead. V stands for vector, and so this would be V1. You've been using this one all along. The other leads right here are V2 through V6. This is V1, the brown one. All right. We are not going to use the limbs. Actually, as long as you have it, the best EKG is done when you have these leads at the same distance from the heart. You don't want to put them too close to the center, but also not way out. And we're going to go with the white lead first, and we're going to place that, I would say, right above the nipple line and to the right a little bit. And then this one needs to be in the same place but on the other side. So you don't want to put this one over here or over here. You want to put it from the same distance from the center, or where the heart is. And then your V lead. Okay, this is the one that you really have to worry about doing at the right place. When you are going to use the first V lead, this is going to go mid clavicle on the 4th costal space. Okay, usually on most guys, unless it's like a big guy that's a little bit droopy, or a lot of the females, this is right across from the nipple line. But don't go by the nipple line. Okay, it's just most of the time it will be there, so just kind of give you another landmark. But you're gonna find the clavicle. You're gonna go mid clavicle, and you're thinking, oh, I can't feel the ribs on these people. If you can't feel the ribs, at least try to find the end of the sternum, and it's about 2 finger widths above that. Okay, and to that side of it, so not in the middle, but over to the right for V1. Okay, that's going to be that right there. And then these leads, the right leg and left leg, are going to go right below the white over here, same distance from the heart, from all these. Okay, this should be like a square. And same with the red one, or the left leg. So again, right below this one, right here. Okay, now this is the proper placement for your everyday leads. So on all the patients that you're going to get, you're going to hook them up like this. Now we're going to start with the other ones. So notice that I laid them out in order, and if you look at your picture right here, it's going to tell you the order that they are, and it even tells you a picture of where they go. But just remember that the first one is the yellow one is V2, and the last one is the purple one is V6. So this is my technique. I've been doing EKGs for 20 years, so I can do this pretty much automatically. But maybe you'll find a different way to do it, but you definitely have to use the placement right. If you place your first vector leads too high or too low, it will affect the way the EKG comes out. You can give somebody a false bundle branch block. If you put one higher and one lower, you can have sometimes some elevation that's not there. So this is the most important part right here. All right, so obviously this is just going to go right across on this one, still mid clavicle down, and at the same distance from the sternum as V1. All right, now I like to place my V4. So this is V1, V2, V4 lead before I do 3, 4, 5, 6. Okay, and actually, I like to do V6 first. So I'm going to do V1, V2, then I'm going to do V6. V6 is down from the axilla. So you're going to go all the way down here, and pretty much, I would say, almost straight, but maybe not quite because you're going to have too much space. But I'm going to say about the same costal space, but under the axilla. That's V6. And you'll see why I do that one first in a second. Then my next one that I'm going to do is V4. Okay, and you're like, oh, he's going all over the place. Okay, so V4 is going to go in between these two. And that's why I like to put these two first and not go 1, 2, 3, 4, because if you do 1, 2, 3, 4, you're not going to get the same spacing. You're going to end up either too short or too long. So I put this one right in between these two. Of course, on females, you know, you're going to have to sometimes push up the breast, and it's going to go right under that crease of the breast, and you're going to place this one next. Now, you don't have to measure the other two because they're literally going to go right in between those. So you're going to take your V3 and right between these two, and your V5 right between these two. And that is your proper EKG 12 lead lead placement. Okay, so please refer to this until we get it right. And also remember, it's on here, but this doesn't really give you a great picture. So just try to remember this. Once you've done this a couple of times, you'll see that it's very easy to remember. All right, so now that you have had your patient completely hooked up, you can do this before or after. But the way that you pull up the 12 lead function on here is going to be by touching your EEG area, okay? Which is going to be, right here. And right here, there's a button that says 12 lead analysis, okay? When you touch that, when there's a patient connected, which we'll show you in a second, you're going to have everything populated here, okay? So we'll get back to that. I just want to show you where it's at. The first thing you need to do, and I would say just do this on all of your patients when you first get them admitted. When your patient is admitted onto your monitor from the central monitoring station, whether it's in ICU or in CCU, what they do in the central monitoring station is they pull up the patient by last name or by their MR number, and then it gives them the option of picking the patient, okay? So it's going to give them something like that at the central monitoring station. The problem is when you admit the patient from the central monitoring station, it will not populate a date of birth, gender, or age. So you need to populate that, and there's two ways of doing it. My preferred way of doing it is going right here on the monitor where is your patient information, right? Just click on that. You can also get to that by going to data and pages, admit discharge. Okay, those are the two ways of getting that. So remember, right here, that's my preferred one. So notice that there's nothing on here. If you have a patient in the ICU or CCU, this would already have the patient's, this little box right here, but it will not have this, okay? So the way that you populate that is just go to this tab where it says load patient, and if the patient is already been in this room, it'll actually just let you pick that patient. And once you pick that patient, it'll populate that. But we're gonna pretend like the patient's not loaded here. So you go to find patient and just punch in their last name. Go to the next one. Now this lights up, hit find, and now it found all the reads that are currently in the system in the hospital. So we're gonna pick this patient because I know where he's at. And right here, this button says load patient information, okay? Now it's done. So now when we go here, the patient information is loaded, and notice that the date of birth, gender, and the age are populated on there. So that is one way of doing it. The other way of doing it, which is not my preferred way of doing it, but some people like that, is you go here and you just click on that and you can enter your date of birth, age, and gender. I don't recommend this method because it can lead to errors. If you enter the wrong thing, now you have the wrong information on a patient, and that's going to be a vigilance report, and the cardiologist might not, agree. So I don't recommend this, but if you just can't pull them up or for some reason, then that's fine. You cannot manually enter this information. Okay, if you manually enter the medical record number there, it will not cross over to Meditech. You have to do it by search. So you have to search for the patient somehow and then pick that patient, load the patient, and now it's ready with the patient information, okay? So don't manually enter the MR number. You have to search for it. If for some reason the patient is not in the system, then you can manually enter it, but as soon as the patient is in the system, you need to load the patient through the system so that it can cross over to Meditech. And that's it. So I'm gonna discharge this patient here, and we're gonna go to the bedside now. Okay, so on this patient, we're about to do a 12 lead. We've already hooked up the leads to the patient. And when we go here, like we just talked about, his date of birth, age, and gender are already populated because we did what we mentioned in the first part of the video. So he's ready to go for a 12 lead. You're gonna touch your ECG spot right here, go to 12 lead analysis, and usually this is what will pop up at first. If you've done a previous EKG, it might be frozen on that EKG, and you would have to hit watch live feed or something like that. But on him, it's already hooked up. So this guy has a lot of stuff going on. He's hooked up to a lot of things. So you're gonna have some interference. What you wanna look at is for crisp lines like these, right? This line is not as crisp, but with as much things that this patient has going on, you're not gonna get everything perfect. You just need to try to get everything so that it's coming across straight on each lead. You don't want waviness like here on CV5 has super wavy. You want to wait until that calms down. There's different things you can do to minimize that. First thing you can do is kick everybody out of the room. We're not going to do that here. There's a lot of people in the room. But you can also try to remove other things that are touching the patient. You don't want to physically be holding equipment because that will immediately create more interference. So try to leave everything the way it is. Vented patients usually are the harder ones. Try to position the vent so that it's not touching the lead, but you can't hold it up yourself because that will give interference. So I would say that I've already seen a couple of times where this is an acceptable 12 lead, even though it looks very chaotic. And this is why I wanted to show you this patient, because this is like about the worst case scenario. We have good straight leads on most of them, okay? And this one, see how it's straight right there? We're gonna wait until this goes away and see if that gives us a better picture. So it's going through there, that's better. We're gonna wait again. Sometimes it takes a little while, okay? Most of the time it's not this chaotic and you don't have to wait this long. They just kind of line up within the first 30 seconds. And then when you're ready to do your 12 lead, there's this button right here. It says 12 lead now, and I'm gonna hit it right now. It'll stop it. It'll give you an interpretation right here, and it'll let you see if this is good enough, okay? I believe that this is good enough EKG. I have Monica here, who is an EKG tech. Monica, would you think that this is an acceptable EKG?
Yes.
Okay. Was there anything that you would do different to try to get a better picture on this patient?
If anything, just like lead placement with like left leg or anything like that, or V5, just kind of move it around to see
if you can get a better picture.
Yes.
Yeah. But this is, an acceptable for this patient because, we did place the leads like we talked about before. And now once you're done, you have two choices. You can you have several choices. You can delete it and do another one. You can print it only, which will not be read by cardiology. This will be only for information purposes. This will not be an official EKG if you just print. The one that we'll do when we're ready is muse and print. So this will print it out there. Oh, what did I do? This will print it out there. See how it came back even though I got out of the screen? It will not go away if you mess with the screen. So I'm gonna hit muse and print. Oh, I guess hopefully there's an order on this patient. So this will go to the cardiologist, and as soon as it's done printing, I think it'll get out of there. You can actually go ahead and get out of the screen. That'll finish doing it in the background. But if you see, this is the button that I was saying, real-time view. If you're ready to do another one, just hit real-time view and it goes back to that. Okay? I'm gonna do maybe one more on one that's a little easier so you can see what more of a less chaotic one looks like. Okay, so now we're gonna look at a patient that's in sinus rhythm, and you'll see the difference in what the EKG will look like. So we've already loaded the patient information on here. So you just go right here, go through 12 lead analysis, and make sure that all the leads are coming in. I know that there's this alarm here we already resolved that. Well, maybe we did. See, now there's a lead right here, V2 is not showing up. So you don't have to, don't video the patient, but I will see if I can get this lead to come in. And notice that whenever I'm doing that, it's going to affect what you're seeing up there. There it comes. See, it's showing up now. So now we're going to wait for all these waveforms to settle. You see this lead 2 right here? It's not coming in very good yet. That will start coming in just a second. See how these are already kind of straight and more normal. On this patient, some of the leads are not what they're supposed to be because I'm using one of our nurses, and so we didn't put the leads exactly where they're going to be, but it'll give you a picture of what it looks like. See how now it's coming in on that lead, right? So we waited a minute. They're all pretty straight. This one right here is coming through, and I think we're just about ready. You have a good line on all of them. Hit 12 lead now. It pauses it, and you would hit your muse and print. We're not going to hit muse and print because it's not a real patient. We're just going to print right here or delete and do it again. But we're just going to print, and now you can go about your business. Again, when you come back to that, if you hit 12 lead, it's going to show the last one that you did until you hit real-time view right there. And that's how you get it going again. And look, it looks even better this time. So sometimes it's worth just trying to do it again if you don't have really perfectly what you like to see. Anyway, that's it. So a couple of other things, we're going to have the big block on all of the patients hooked up. This one right here. So we'll keep this one in all the rooms. We'll get rid of the single one because that way we'll be ready. And then we'll also have the V leads in every room ready to go. Just make sure that, like we said before, that you hook up your patient properly to the first leads when you first put your patient there, so that you don't have to redo all your leads. And if you're doing an EKG in the middle of the day, you might have to replace all the leads because the patient might be a little bit dirty, they're not reading well. So it's probably a good idea, if you want a really good quality EKG or 12 lead, to go ahead and change all the leads. If you have any questions, please post it in the comments here. We will do one-on-one training with everybody as we get going. So, if you have questions, you can also ask them. All right, thank you.